What's going on, everybody? Long time no talk. I am officially a second year family medicine resident. I'm still here. I just haven't been making videos because I've been focusing on, just residency and trying to learn how to be a good doctor. So I am currently on ICU rotation. I had a clinic all day today. I came in this morning early because I needed to do some administrative work. I had a bunch of refills that I needed to get done, some paperwork that needed to get done. So I decided to go ahead and come in early for that. I have a clinic again this afternoon. And then I have ICU basically all week long. Yes, as family medicine, we rotate through the ICU. And I remember ICU as a medical student, I really enjoyed it. I even considered doing internal medicine at that point because I enjoyed ICU so much. That was after I already knew I wanted to do surgical obstetrics. So it competed pretty hard, but basically the winner of that argument was that I still wanted to offer pediatric care. I still want to take care of kids, and in internal medicine you don't do that. You only take care of adults. So it was a pretty easy way for me to just decide to go into family medicine with surgical obstetrics. I just came off 2 weeks of nights, of OB nights. I got up to 94 deliveries, just starting my second year basically. And I have assisted about 10 C-sections at this point. A lot of people want to know, how does this family medicine residency work with the surgical obstetrics? Kind of how do they incorporate that into the 3 years? Basically, your second and third year you start taking C-section call. Your second year you start doing primary assist. You're on call for primary assist. You do a few, with the attending. And then once you've done a few, then you go ahead and start assisting yourself. And then third year, you kind of graduate into being primary surgeon for C-sections. Of course, there's always an attending there. And then a second year is your assist. So that's kind of how they fit it in. And the hard thing is that, yes, a lot of the weekends and easy rotations when you're doing a lot of clinic or, an elective, you take a lot of C-section call because you can, and that's basically how they fit it in. It's been really fun. It's hard because now even whenever my cell phone rings, it's kind of a little bit triggering because they could just be like my mom calling, but because of that whole C-section call, it's kind of jarring, which is kind of funny, but it is what it is, I really enjoy doing sections, and that's kind of how it works. I've been able to do a lot of, I've been able to learn so much here doing OB with all my preceptors. In a lot of programs, the kind of patients that we are managing here is like fellow level care. As an intern, you're expected to manage like preeclampsia, postpartum hemorrhages, and know what to do because we get so much of it. You always have an attending, a family medicine OB attending, and there's always an OBGYN attending available, and they are so nice to us. They kind of get the goal of the program to help us be able to do rural family medicine with that surgical obstetrics, being able to manage a lot of the patients and stabilize, our patients with preeclampsia. I've seen an eclamptic seizure in the ICU with my own eyes. I'd only heard of them before. Managed that. Managed so many postpartum hemorrhages at this point that it's just second nature. And yeah, you kind of decide what medications you prefer compared to other people. Oh dang, I missed this light. So yeah, that's kind of what I've been up to. I just want to say hi. I'm still here. If you guys have any questions about family medicine residency, specifically with a surgical OB focus, if you guys have any questions about my program, I am happy to answer them. I'm still here. You guys can always leave comments, and I'll see you guys in the next video whenever I decide to make that. Bye.